It has been called a slow motion disaster. Contamination from toxic chemicals known as PFAS seeped into the water supply of hundreds of farms and properties across Maine. The source was wastewater sludge trucked to farms and spread as fertilizer for decades.
Now, two doctors are taking a deeper look at Mainers dealing with the emotional toll caused by the ongoing crisis in an effort to provide better monitoring and mental health support in the future. News Center Maine's Vivian Lee shows us more in this report.
This chicken's on fire.
Ashley and Troy Rennie love making dinner together, but worry is never far from their minds.
You try to block it out some days, other days it's like, it's all you think about.
In November of 2020, just months after purchasing their dream home, the couple discovered their drinking water was poison, testing more than 1,200 times Maine's current drinking water standards for PFAS chemicals. The source of the chemicals was in wastewater sludge used as fertilizer on a nearby dairy farm that seeped into the groundwater. Escaping the stress of toxic exposure is impossible.
You don't know if your health is going to start deteriorating. You don't know if your house is still worth what you thought it was worth.
Seeing folks in my clinic, some people, it's destroyed their lives, and understandably.
Dr. Rachel Criswell is a family practitioner at Reddington Fairview General Hospital in Skowhegan, monitoring patients with elevated levels of the compounds in their blood. PFAS chemicals, which take years to break down, have been linked to a number of health issues, from breast cancer to thyroid problems and low birth weight in newborns. The couple participated in a groundbreaking study by Dr. Criswell and Dr. Abby Fleisch, a pediatric endocrinologist at Maine Medical Center. The two-pronged study involves 100 patients who range from elevated to no exposure. Physicians are looking at the mental health impact and the different ways people may have been exposed besides drinking water.
They're eating wild deer, whether they're eating wild fish. And we hope that looking at that data along with blood levels will tell us something about exposure pathways in the setting of sludge.
Adam Nordell and his wife, Johanna Davis, had to shut down their organic farm after PFAS was discovered in the water, the soil, and inside their bodies. Adam, who spent years working the soil and eating what they produced, also participated in the study.
How much time people spent engaged in various types of activities that might put them at risk.
Now, patients dealing with PFAS exposure may get some much needed help when it comes to blood testing, which can run between $400 and $600. Recently, the legislature's Health and Human Services Committee approved a bill that would require insurance companies to cover the complete cost of blood testing. Troy and Ashley, meanwhile, are encouraged that the data from the study could be used to guide doctors when it comes to monitoring any potential conditions and improving mental health support.
How much has this affected our health, and how much do we need to watch for this, moving forward?
Answers to nagging questions desperately needed now. In Fairfield, Vivian Lee, News Center, Maine.
By the way, the study's findings are expected to be released within a year. We're going to have more information on our website and app for you.